5 bold healthcare authority reform ideas you haven't heard of yet. You've heard of the proposed solutions out there to fix the US healthcare system, but do you know what they are? The US spends more on healthcare than any other country in the world, and our citizens pay higher prices for medical procedures than patients in any other developed nation. While many different solutions have been proposed, it can be hard to keep track of all the different concepts that have been introduced over the years, from everyone from single-payer advocates to free-market libertarians and everything in between. 1. Let consumers choose from a wider range of providers. Introducing more competition into the healthcare market by allowing consumers to choose from a wider range of providers is a reform idea that has been gaining traction in recent years. By expanding the number of providers, healthcare authorities can create more competition, which can lead to lower prices and improved quality of care. Additionally, this reform would allow consumers to have more control over their healthcare choices. One way to achieve this goal is to create a system of healthcare vouchers, which would give consumers the ability to choose their own healthcare provider. This reform would increase competition among providers and give consumers more power to choose the best provider for their needs. 2. Create financial incentives for positive behavior. Healthcare reform is necessary to ensure that all Americans have access to quality, affordable healthcare. One way to achieve this is by creating financial incentives for positive behavior. For example, people who quit smoking or lose weight could receive lower health insurance premiums. This would not only improve the health of Americans, but also save money on healthcare costs. Insurance companies have long used incentives to encourage people to quit smoking, for example. The Affordable Care Act, ACA, tried a similar approach, but it only applied to Medicare recipients. Under new healthcare authority reform ideas, insurers could offer lower premiums for positive behavior such as regular exercise and healthy eating habits, or higher premiums for negative behavior. Another way that healthcare authority reform ideas could encourage positive behavior is by requiring healthcare providers to provide relevant information in a timely manner. 3. Provide stronger support for community care alternatives. One way to reform the healthcare authority is to provide stronger support for community care alternatives. This could involve redirecting some of the money that goes into hospitals and clinics into community health centers. It could also mean creating more incentives for people to use these centers, such as offering lower copays or making them more convenient. Community care has been shown to be just as effective as traditional medical care, and it often costs less. One of those options involves strengthening healthcare authority support for community care. Community health centers have been shown to be just as effective as medical facilities, and they tend to cost less. However, some of them are small and struggle with a lack of resources, while others face funding problems or get overlooked by patients who prefer hospital visits. 4. Increase transparency about public spending. One way to increase transparency about public spending is for the healthcare authority to create a website that provides detailed information about how public funds are being spent. This website could include information about the budget, expenditures, and outcomes of healthcare programs. Additionally, the website could provide links to relevant data and research. Such a website would help the public hold the healthcare authority accountable for its spending and help inform future healthcare reform efforts. 5. Establish better links between community and hospital services. A recent study showed that nearly 60% of patients are discharged from the hospital without a follow-up appointment. This number is especially high for vulnerable populations, such as the elderly, disabled, and those with chronic conditions. Healthcare authority reform could help establish better links between community and hospital services so that patients have a continuity of care after they leave the hospital. This would help to ensure that patients receive the necessary follow-up care and treatments, and would ultimately improve health outcomes. Finally, we hope that these 5 bold healthcare authority reform ideas have given you some inspiration for your next reform proposal. A great healthcare authority is about to be the foundation of a stronger, healthier, and more equitable society. Healthcare needs to be the basis of our work in politics and public service. A bipartisan effort is necessary to ensure quality healthcare for all Americans. Let's start working together towards a better future today by implementing one or more of these ideas as part of your next healthcare reform proposal.